professional may refer to this tooth as tooth 29. Before we begin, would you like to review some of the common myths and misconceptions surrounding root canal treatment?
Right now we're going to be doing surgery squad again. Now, in my recent video, we were going to do a colonoscopy, but then I thought that my video was going to get flagged down, and I didn't want that. Plus, we had to play with a butthole, and I don't like that. But right now we're doing a root canal, which has something to do with your teeth. I don't know what it has to do with your teeth and why you have to get it, but let's do this. Would you like to review some of the common myths and misconceptions surrounding root canal treatment? No, thank you. I don't want to see any
problem.
pictures.
Let's move on. In effort to make our patient as comfortable as possible, we need to inject a local anesthetic into their gum line. But first, apply a topical numbing gel to the injection site. This will help reduce any discomfort the needle may cause.
Where was this when I was
Next, we can inject the local anesthetic. After the local anesthetic has taken effect, the area should become numb for a few hours. Use the syringe to inject the local anesthetic into the patient's gums. Just below the tooth we'll be performing a root canal treatment on.
Oh God, what is this? I'm 100% sure. Okay, never mind. Oh, dang.
Let's give our patient a few minutes to relax and for their mouth to become completely numb.
Jesus Christ.
Now that the patient's mouth is numb, we can move on to isolating the tooth. Since our patient's saliva contains contaminants that we don't want getting into the tooth, isolation is a critical step to hole into the rubber dental dam and place it over the tooth.
Learning new stuff. Click where indicated to place the dental dam.
Once the rubber dam is in place, put on a tooth clamp to keep it from moving.
What?
Next, we'll need to... So far, so good. Now that the tooth has been isolated, we can create our access cavity in the tooth using our drill.
Edited the video because there's really nothing to watch at those parts. That looks like that would hurt.
The next step is to clean and shape the tooth's canal using a root canal file. Go ahead and give it a shot.
Oh my gosh.
At this point, the dentist would measure the depth of the canal using a combination of x-rays and specialized equipment. If a dentist fails to measure properly, it could mean that the tooth would be at risk for reinfection. Now we need to clean the canal of the tooth using sodium hypochlorite, commonly known as bleach.
Bleach?
We'll let the bleach sit in our patient's tooth for about 5 minutes to make sure that all the bacteria and tissue inside the tooth has been dissolved.
Surgery and stuff that you have to do doctorial-wise. It's like,
Great. Now use the suction to remove the bleach from the patient's tooth.
I mean, it's like, okay, let's fill this tooth up with bleach because it was infected, instead of taking the tooth out and replacing it with another one. Like, wouldn't that be easier?
Next, we'll need to fill the tooth using a rubber compound known as gutta percha. Gutta percha is often preformed as tiny, thin cones that we'll insert into the clean canal of the tooth. I've already added some sealant to the gutta percha cone. Let's see what you can do.
Gutta percha. Whoa. Oh. What the? Looks like a pencil. Oh my god.
Looking good. A heated instrument is now used to remove the excess gutta percha.
It's buggy. Click the gutta percha to remove the... Sorry.
Pack the gutta percha into the tooth canal using a plugger.
the gutta percha to pack it into the kennel. Okay.
After the gutta percha has been placed, it is common that additional x-rays are taken to verify that the canal has been adequately sealed off. Once the dentist verifies that the canal has been sealed, a filling or canal, patients should expect some mild sensitivity and discomfort. This can usually be relieved using over-the-counter pain medication, such as ibuprofen or naproxen, by brushing twice a day, flossing daily, scheduling regular dental visits, and avoiding smoking. It is possible to greatly reduce the need for a root canal. And that's a root canal. Why not check out some of our other amazing surgeries here on SurgerySquad.com.
Alright, so this one is a hair transplant, and as you can see from the background image, if you are, or as you can read right here, I'll read it out for you. Before you scrub in, this surgery may contain graphic procedures inappropriate for children or squeamish adults. SurgerySquad.com is not a substitute for professional medical advice. Period. In order to play this game, you must press the start button. That's not that actually good, but it's a hair transplant, and I don't know what the fudge that is, but let's find out.
Squad's virtual hair transplant. I'm Dr. Susie, and I'll be assisting you with this surgery today. A hair transplant is an outpatient procedure that involves transplanting hair follicles from one part of the body, known as the donor site, to the balding part of the body, known as the recipient site. Although hair transplantations are typically used to treat male pattern balding, they can also be used to fill in scars caused by accidents or surgery. Today we'll be using the strip harvesting method to treat our patient's male pattern baldness. Strip harvesting involves removing a small strip of scalp from the donor site under local anesthesia and transplanting the pieces or grafts of the scalp into the recipient site of the patient's head. Before the surgery, our patient was advised by his doctor to avoid using any medications that may result in a poor take of the grafts. These medications include, but need to first shampoo his hair with an antibacterial agent to help prevent any infection. I think you can handle that.
Okay, there, that's enough. Don't want to waste any time. Click and drag to work up a good lather. Oh, yeah, baby. So we're just doing this without any water. I don't know, but it bugs me putting shampoo in my hair.
So fresh and clean. Thoroughly rinse the patient's hair, and we're ready to get started.
I'm sorry, I'm so tired. Okay, you know what? I'll try to do that.
The next step is to define our patient's target hairline. Go ahead and outline where we want the patient's hairline to be.
Yo, hairline though. Shit.
That looks good to me.
No, it doesn't. Where's
Let's prepare the donor site. We'll begin by trimming the patient's hair in that area.
Click and drag under the tape to shape the donor site. Click continue when done, and then you can continue right. I'm just kidding. So I have to shape. What the fucking hell?
Now that the patient's hair is trimmed down, we'll need to mark the area that we'll be removing.
Like a mustache. At the police coming straight from the underground.
Great job! Inject local anesthetic into the marked injection sites to reduce the amount of discomfort our patient may experience.
Shut the fuck up! How do you do that? How? Oh, you can see the ripples in this dome.
Great! He won't feel a thing! Now we'll need to remove the piece of scalp we outlined from the donor site. Use the scalpel and cut along the line to begin the process.
Bitch, that? Oh god. Alright. Oh man, I can go back and dig. I can hear it. I can feel it too. It's like, I think that was too fast. Oh.
Next, we remove the piece of scalp from the donor site. Make sure you have a good grip.
Shouldn't have ate before this. Oh man, look at that pizza. Look at that pizza. Look at that pizza.
Once removed, we'll prepare the piece of scalp for grafting by dissecting the individual follicles. But before we do that, why don't you go ahead and suture the donor site?
Suture? Whoa, what are you doing? I didn't click. Okay, so you're telling me that he had all that skin. Oh, actually, it's quite a bit of skin. Okay, makes a little more sense. We should know how to fit. Oh my gosh, you're taking forever. Dude, come on, what the fuck is you doing? Stop taking so goddamn long and hurry up. Come on. This freaking computer is so slow. I'm just kidding. My filament.
Great, let's get to some dissecting. The first thing that we need to do is cut the removed scalp into sections. We'll dissect this one section of skin while our medical assistants take care of the others. Let's remove the individual follicles from the donor material using a pair of tweezers and a sterile razor.
We're just taking little bits off. Oh, we're taking like parts. I see.
Nice job. This step is repeated thousands of times to get each follicle prepared. I'll have my assistants finish up. To prepare the recipient site, you'll need to first inject a local anesthetic into the scalp. We don't want our patient to be uncomfortable.
So let's stab him in the head.
Now we need to make tiny incisions into the recipient site so that we can place the grafts into the scalp. Use the microblade to make the incisions in the recipient site.
Dang, you just right in the dome piece. Probably wouldn't feel that.
Perfect. With all of the incisions, it's getting a little messy there. Let's get that cleaned up.
No, I did not stab him in the head that many times. I stabbed him 3 times. How did he get 1, 2, 3, 4, 7,997, 8,000? Oh crap, I messed up accounting. 8,001, 8,002, 1.76 billion. Wow. He had 1.5 and a quarter of dots on his head. How did you stab somebody that many times?
Much better. Use your tweezers to pick up and insert the hair grafts into the recipient area.
This sounds like the most boring job ever. For the next couple of weeks, this boy, he'd rather be bald than look like that.
You're a natural. Now that you've got the hang of it, we'll repeat these steps for the remainder of the recipient site. After the procedure has been completed, our patient will be prescribed antibiotics to prevent wound or graft infections. For up to a week after the procedure, the donor area may be sore and some numbness may be experienced as well. Our patient can also expect moderate swelling and redness during this time. Shampooing of the recipient area is typically started 2 days after the surgery. This is important as it prevents scabs from forming. If scabs do form and are left to bond to the hair shaft, the newly transplanted hair follicles may be lost. In about 10 days, our patient will return to have his sutures removed. During the first few days after surgery, almost all of the transplanted hairs will fall out due to shock loss. Shock loss occurs when the hairs are traumatized by their relocation. Within 2 to 3 months, the patient can expect new hair to begin to grow from the treated area and continue to thicken during the following 6 to 9 months. And that's hair transplant surgery. Why not try your surgical skills in another surgery here on SurgerySquad.com?
That looks like something that would be good for another video. But that doesn't for now. Thank you guys for watching. Have a good day. And like the video if you enjoyed.